So as I've mentioned in other videos, we've talked about the reason why patients actually come into our office. Well, the main reason is obviously for pain. And as we mentioned before, only 5% of your nervous system is for actual pain. The other 95% is for supplying organs, cells, tissues, and systems of the body. Every patient that walks through our door, one of the main things that I really try to convey to them is that chiropractic absolutely heals nothing. The body is the actual healing doctor. So you're the actual doctor. So your body does that healing. And one of the things that we really like to pride ourselves on in this office is what's called spinal correction. We really try to get our patients as corrected as possible, but then teach our patients what we can do so that way they can maintain it as much as possible. So let's talk a little bit about correction. I'm going to go through a couple films here. This is one of our patients. Her name is Candace. And so what we do for our patients when they come in, we want to see what their actual spine looks like, okay? Because to see is to know. In the chiropractic world, we talk about that. You want to take x-rays because you want to be able to visualize, not only for me to see, but also too for our patients to see. So the one film that you're looking at here first is what's called a lateral cervical. This patient is basically looking in one direction, and we take a side view of that patient, and this is what's considered their cervical spine. Each and every single individual vertebrae on this patient, okay, she's 48 years old. When she came in, as you can see here, between each and every single bone there, she actually has disc degeneration. Her cervical curve, so when we talk about the cervical curve, to get 100% life to your organs, it needs to be at 43 to basically 45 degrees. So that's the blue line, and the red line is where she's at the worst area of her spine, between 5 and 6, 6 and 7. That's where the worst of her problem is at. That's where the most degeneration is. So the first film, as you see, it's at -7, and then she also has 29 millimeters of forward head posture. The second film you're going to take a look at, so the first film that you're looking at is October 4th. That was 2017. And then this was just 12 visits later. We actually corrected her spine and got her to 43 degrees. Now, when she first came in, she was having headaches. She said she would have about a migraine to 2 a month. She was on multiple medications. She actually had high blood pressure as well. And over time, through these visits, not necessarily right at her 12th visit, which would have been this second film that you're looking at here, and as you can see, it corrected the curve in her neck. Her migraines were gone at this point, and through the work with her medical doctor, we actually have a medical doctor on staff now as well. Through them, we worked and helped her get off her medications. And you ask, well, how can that be? How can you help a patient get off their medications for their blood pressure? Well, it just so happens these nerves right here in the neck, they go directly to her heart. So by taking pressure off her nervous system, again, chiropractic did not heal them, but what we worked with was getting her body to actually function and heal at that higher level. In this third film, so you probably ask, well, how can you achieve that? Well, we do that by, when they first come in, we take the first film, but then also too, we take what's called a stress weight bearing film. And that film actually helps us to see, and what you're looking at now, if you look kind of up in the upper right-hand corner, and then also too, kind of around her neck, we use weights, and then we also use some pulleys to actually change that curve. And what's key is what we do in this office is what you do after the adjustment. So maybe some chiropractors that you may go to, you may go in, do some therapies, you'll get adjusted, and then you leave. Well, the key thing to understand is that muscle has memory. If you go and do an adjustment and you're expecting for that bone that doctor just moved, that chiropractor just moved, to actually hold in place, unfortunately, that spine's been in a bad place for a long time. So what we want to do is get that muscle to actually have good memory. So we actually use vibratory healing, or vibratory therapy, some doctors call it. We use that in our office to actually mold and transform the spine, working on the muscles surrounding that spine, along with working on the ligaments as well. Vibrational healing has actually been shown to not only increase healing by 50% more, it works with metabolism, increasing that, and obviously a lot of people love that, but it just gets the body functioning a lot faster at a higher level through that vibrational healing. So if you've never had your spine looked at, or if you're curious about spinal correction, spinal corrective chiropractic care, what we actually give you the opportunity to do is come in, we'll get your spine looked at. And what we really feel like we pride ourselves on is being able to sit you down, and you'll have such a great understanding that you can actually look at those films and understand and know what normal versus abnormal looks like. Because again, we take pre and post film, so that way not only can you visually see what your problem is, but number two, two, you'll visually be able to see how much correction you can actually get. So again, if this is something you want to take advantage of, just give us a call here at the office. The phone number you can reach us at is 615-646-6700. Take care. Have a good day.